catalyst for creating this working group is the fact that, climate change has been called a code red for humanity. I mean, we're seeing impacts happening all over the world on almost, a weekly, even daily basis. We're seeing exacerbations of wildfires, we're seeing escalated drought, we're seeing more intense hurricanes, we're seeing more disasters. And so as a result of this, we're seeing more health impacts. The health impacts are happening in communities, right? And as a result of that, we are seeing exacerbation of existing diseases, but we're also seeing new and emerging diseases and diseases moving into places where they weren't formerly. And so when we think about, what type of health professional really is needed to recognize and respond to these types of changes in disease dynamics, we really think about, the frontline field epidemiology workers. And so that was really the impetus to start this working group. And additionally, at the Global Consortium on Climate and Health Education, we have a wonderful working group member there named Gilma Mantilla, who is a former director of an FET program in Colombia. And so she was the one who made the link for the Global Consortium on Climate and Health Education to get together with TEPHINET on this initiative.
In 2007, I was called to be part of the Global Consortium on Climate and Health Education. And I thought that was like a good opportunity to reconnect again with TEPHINET, and I have the opportunity to know the current director of TEPHINET, and he was like a very key person to say, yes, I think that's something that we need to address. So let's see how we can work this out. So basically, we just started having some online meetings and trying to find will be like another partner that we can involve with, and we decided to make some connection, and that was the way that we built this group. And our main concern was how we can bring environmental issues like climate change into the training of the EPTB programs. So basically we were thinking is that what is happening right now with climate change and the impact that we have seen in different sectors and also in health, it was important to create this group and try to equip TEPHINET staff to the climate educational and programmatic development, but also to keep EPTB students and field epidemiologists with the knowledge and a strategy that they need to take action related with adverse impacts of climate change and health in their own regions. I think that